Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone. I'm your host, Don Hardwick, and thanks for listening to Follow the Medical Record. You can learn a little bit more about me and my background on our website at MRO CORP and can connect with me on LinkedIn. Be sure to follow us also on Twitter at MRO Corp, CORP. I want to thank everybody this morning and especially our guest, Sherine Koshy, for how to select the perfect vendor and the journey that one of our large facilities, healthcare system in Pennsylvania went through in the selection of a vendor. And this can apply to not only the ROI industry, but the steps involved to any vendor selection. So thanks, Sherine, for joining us. I really appreciate your time and taking the time out of your busy schedule.
Thanks, Don. I'm happy to join you today.
Thank you. If we can start, Sherine, number one, give us a little bit of your background and your scope of oversight at Penn Medicine and a little bit about Penn Medicine in general, the size, the request volume, and what then stimulated your interest in your going to a vendor in general. I know you had a vendor that was doing your ROI before. What stimulated the change? And then describe the steps that you used in your vendor selection.
Sure. So by background, I am a Temple HIM grad. I have been at Penn Medicine for 17 years. I oversee the functions of coding, operations, EMPI, central fee abstraction, which is physician billing, and retrospective CDI teams under Penn. We have 6 hospitals. I oversee 5 of the 6 hospitals in our area. And we have 10 multi-specialty centers, over 800 plus physician practice locations, and about 7,163 physicians at the hospitals. Some Penn Medicine fun facts. We had the first hospital in the U.S. that opened in 1751, and the first medical school in the U.S. opened in 1765. And University of Penn Medicine has been ranked in U.S. News as our top 10 in our area and #1 in our state of PA. So very, very happy to be a part of the Penn Medicine team. Our average monthly request volume is 20,000, to give you an idea of the volume. And as you mentioned, Don, we have always outsourced release of information. And that is not the only function in our HIM world that we outsource, but for today's purposes, it's release of information. And so when I came to Penn 17 years ago, it was already an outsourced function. And I strongly believe that it's a necessary function to be outsourced, and having a good partner to help you with that is really important. And I know we will talk about that journey of moving from one vendor to a new vendor and the reasons behind it. So I can go into that if you'd like right now.
Yeah, if you would kind of give our listeners what challenges you faced in making your selection and your change. What stimulated your desire to make a change? Because if you've got a vendor in there, they're doing a good job. You may go out for an RFP occasionally, every so often, just to see what else is out there. But you typically, or a facility would typically make that decision to really go forward with a change based on some pain factor. So if you could give our listeners kind of what your thoughts are and what motivated you.
You got it. So it was the level of quality. So we were experiencing a backlog in our requests, which of course leads to bigger troubles, not just internally. We start getting patient complaints, we start getting requester complaints, and then compliance was getting involved and OCR complaints. So that level of quality was really suffering. Customer service was declining. I was starting to get, every time we were talking to talk about an action plan and how we can do things better, it was more of a reaction. It wasn't a proactive approach in taking action and making the corrections needed, and just felt like a lack of partnership because, really this vendor partner is your patient facing and represents you. So having that lack of trust and that loss in the relationship and the lack of communication really was starting to decline, and it really made us want to look at other options. We knew that the patient complaints were on the rise. We knew that there was a lot of turnover in staffing, and then the productivity and turnaround time. These go together, and they could not meet deadlines that we needed, and so the compliance was at risk. And then another part of this that's huge is technology. The platform that we were using was not user-friendly and really lacked the ability to integrate with our EHR.
So in your evaluation, did you bring in other departments such as IT, when you're talking about the technology piece, to make a team approach out of your vendor selection, but your vendor evaluation during this process?
That's correct. Our IT really did help us. We did do an RFP, and the technology portion was really, the integration with Epic and having our technical team understand what it was needed, and so making sure whatever partner we were going to choose was the right choice using technology in there.
That's kind of what I want to unpack this a little bit on the team that you brought together, why you brought that team together from your organization, who all was involved in that, and just kind of your evaluation tool. Did you use a criteria-based questionnaire that was a scoring methodology for all of the vendors that you brought in and evaluated?
That's correct. It was a scoring method that we used, and it's something that Penn has in place for their RFPs. So it was helpful that I didn't have to create something from scratch. It's something we use when evaluating the vendor, and some of the questions that are really important. And it's feedback from technology, so IT, from privacy, from compliance, legal was heavily involved, and then our practices, because this was not just impacting HIM, but our practices as well. So having their input on what we needed to see in this evaluation.
Well, having uniformity among all of your disclosure points certainly critical in this business today for disclosure management and managing properly all of the rules, the regulations, so that everything that's going out of the hospital theoretically is following the same guidelines. So just a hugely important piece of it. How did y'all approach this, Sherine, on the rollout? You've got 800 physician practice locations. That's a lot of locations. So how was the process of onboarding with all the locations that you had to deal with?
So there was, MRO did an excellent job with, once we selected our vendor of choice and, going on this journey, they were really helpful with the implementation team alone, helping us because, like you said, Don, how do we communicate? There was a lot of meetings, a lot of emails, a lot of documentation that we had to track, a lot of feedback we had to get. from those teams. And so there was, two different, for under the leadership of the practices, two leaders that kind of joined our meetings and made sure that they would disseminate that information that they were getting. And to make this transition, it was a lot of communication and timing, and making sure that we had the right folks there to help them in a situation. And MRO really did a great job with helping us through that implementation phase.
What kind of impact hospitals are faced with not only the normal, I'll just say the normal impact of onboarding a new vendor or a change in vendors as you've gone through, but now today, facilities are faced with not only that, but the impact of COVID and working remotely and still trying to get out the volume of your 20,000 requests a month doesn't stop. But how that is applied and managed is totally different today. How's that transition been for you?
And so we were very lucky that a lot of this transition happened before COVID, but MRO has been a true partner with so many changes that came down. We had to quickly adapt to sending staff home. We had to, how do we handle request walk-ins? What do we do? Planning the scenarios. And so making sure their staff had the equipment they need to work from home, and to quickly adjust when we were ready for them to come back in. And so they were, the first few folks to actually come back from an HIM standpoint was our MRO client facing, patient facing team members, and just making sure they were supported. And, it was weekly testing, whatever it was that our health system kind of required for that hospital. MRO was really great with complying and making sure we met the standards, but making sure their staff felt safe also, and a part of our team.
If you had to give our audience any suggestions on this whole process of the COVID environment today, if they were looking at a vendor change, would you discourage or still encourage because of the underlying root cause of the initial evaluation or reasons for changing vendors? Or is COVID presenting, in your mind, does that prevent any kind of delay in decision making?
If there are issues, underlying issues, they're not, and not being addressed, and you're at a point where you needed to make a change, even with what's going on today with COVID, your organization is at risk. So you want to make the right decision for your organization and make that change. And I fully think that MRO would be able to do that transition from a remote environment. Many of the things that we did could have definitely been done. It was great to have them on site. It was great to do presentations and meetings on site, but we really quickly have adapted to the different ways that we can do a virtual meeting. So you still stay connected, emails, and things like that. So, I definitely think that it would be a smooth transition, even in today's world with COVID.
If you could sum up, I guess, for our listeners, the lessons that you've learned in this process of your vendor selection and the steps that you went through, what kind of lessons would you impart to our audience here?
It was very important from the beginning to communicate with leadership. So having the leadership buy-in and making sure that they understood the impact, the risk, and why you're making this change. And then as you do your RFP, making sure you have those key players involved, like we talked about technology, we talked about compliance, privacy, and legal, and then representation from your practices. So you have the right folks from the beginning as why we need to make this change. And then, we talked about the tools, making sure the right tools for the RFP and the grading and scaling. And then as we went forward, there were things that we knew with our implementation, understanding our contracts. What were the BAAs, payers, service agreements that are around that we needed to comply with? What were the limitations with the technical solutions we currently had, and what were we looking to move on towards? And making sure you close any of those gaps. So, making sure, for example, if it was something with Epic integration that was lacking, I'm going to make sure I have that with this new vendor that I'm going with. Also, communication and change management, making sure, you ongoing meetings, even after implementation, after go live, doing a pulse check. I like how you call those pulse check meetings, making sure all stakeholders were involved and on the same page, and just developing the partnership, making sure you're transparent with each other. Everything's not smooth sailing. There's always going to be bumps in the road, and making sure we can talk to each other about those bumps and making sure we have a team effort on both sides to make sure the transition is successful, making sure we have a reliable partner, and just being responsive. I acknowledge the email that you sent me. I might not have my answer right now. I'm looking into it, but I've acknowledged the question.
Yeah, I think in most of these situations, communication both internally and with your vendor on a very consistent methodology is probably the biggest key to success. That's the reason that, in our organization, we have set up a series of calls that we cover material at different steps of that process pre-go live. And then we kind of migrate those same concepts after go live until everything is working smoothly. Because as you said, there are going to be some bumps in the road. There's just that you didn't anticipate. I know we as an organization try to anticipate as many of those bumps in the road and get them taken care of ahead of time, but there's always, with 800 locations for physician practices that you have and the number of hospitals, there's just a lot of moving parts in there. And because of that, if you can keep on a cadence of communication, most of those will be addressed ahead of time. Not all of them, but a lot of them will. So very important. Sherine, is there anything else that for our audience, looking back at your implementation from pre-go live through go live and then post go live, that you would have done differently perhaps, or is the process that unfolded with your selection pretty much on target with what you expected?
I will say that since it was my first experience with selecting a new vendor for the health system and the pressure, it was very stressful at the moment, but the partnership, having that implementation team, and as organized as MRO was, really helped ease my anxiety with this. And, I had a really great experience. I would not do anything different, honestly. I felt like, yes, there were bumps in the road, but we addressed them. I felt like the team did a great job and it was very successful.
Well, Sherine, thank you so much for your time and going through this process. I think it's helpful for our audience to understand these steps. And I think the biggest piece of this, the biggest takeaway, is preparation. You were prepared with what you were looking for within this change, okay, where you had very clear-cut things that you wanted to see different in your new vendor than you had in your old vendor. Very clear-cut anticipated outcomes, number one. And number two is the degree of communication pre-go live or even pre-selection, where you brought in all of the players that were going to be impacted by your selection at the end of the day. And then carrying that communication and those meetings on through the implementation is probably the biggest key. In looking at these, for me, is probably the biggest key to a successful implementation and partnership with your vendor. As you said, it is an absolute partnership. So, Sherine, thank you so much for being on the show today. I really appreciate it, and I know our audience will as well. And so I'll just close in saying that for our audience, for more insights on the patient medical record through the health system, visit our shows page at mrocorp.com and be sure to explore additional resources and thought leadership on our webpage. You can also check out the program at healthcarenowradio.com. And finally, be sure to connect with us on Twitter at MROCORP. This is Don Hardwick, your host. Thank you very much.